We came in 1981, we came to St. James to work with a pastor there in the Baptist church. We met two students from his church that were studying in the U.S., and they told us that he needed some help. So we did that, finished all that in time for Hurricane Gilbert to knock some of it down, and helped rebuild it. And then he told us a friend of his here in St. Anne's needed help, and that friend directed us to Steertown. Upon coming to Steertown, we came to work with the children. We realized the way to win in the heart of any community is work with children, their children. And so here in the ball field next to the community center, we had like a vacation Bible school or Bible club for the children. Immediately began to meet their parents. And through conversations we had, we realized that it's a very violent community, very needy community. And we kept trying to work with area churches to help meet that need, and realized after a year or so that it wasn't going to happen. It was either going to have to happen through us or it wasn't going to happen. And so we had a difficult decision to make. Were we going to walk away and leave the situation as we found it, or try to make a difference? And I had a situation where I dealt with a couple of children who had spent the night in the cemetery. Their father had left them overnight because the police were looking for him, and they hadn't eaten, and I held them in my arms. And it was during that time holding those two children I realized we can't walk away. So we began construction on this building, determined to build it if it took us 10 years, building it just with donations. God wonderfully supplied through a couple of ladies in the U.S. over $100,000 to help get this built. And so we finished it. Now we're seeing how God can use it in the community. We're still finding that out, vocational training, feeding programs, medical and dental clinics. It's a work in progress, obviously. We do about 25 groups a year to Jamaica, every year, and have for many years. One of those groups comes from Michigan, a Catholic high school in Michigan, every spring break. And they, over the last, about 3 years ago, for 2 years, a young man was on that team in high school. His name's Josh Badal. And Josh graduated and went to Xavier University. And when he went to meet with the people in the interfaith department, he told them about coming to Jamaica, and they said, hook us up. So he told them about us, they called us. We did it all by internet and phone. I didn't meet anybody on the team until they got here, except Josh. I knew Josh. So it's been a great team. Obviously, they're doing great work.
What we have is we have 5 stations. The first station is a somewhat obvious medical station intake. So we get individuals' biographies, whatever we need, as well as what complaints they have as they're coming to see the doctor. The second station allows them to have their blood pressure taken, as well as their vital signs, their weight, and we further the questioning of individuals so that the doctors have a better sense when they come up to the third station, and that's actually the medical clinic, where they get to have an interview with either Nurse Paula or Dr. Rich.
Xavier University contacted the hospital that I'm a faculty at, Good Samaritan in Cincinnati, and they wanted to collaborate together to do a first-time medical mission to Jamaica. And since I had done 26 missions before, that's why they asked me to lead the medical team for this. Each country we go to, we see different disease types. But I will tell you, in Jamaica, you have a lot of high blood pressure. I am surprised at the amount of high blood pressure that 40-year-olds have that isn't being treated. So we've been sending a lot of the patients that we screen here to see their regular doctors here because they need long-term follow-up on their high blood pressure.
And with prescription in hand and the diagnosis, they go to station number 4, which is the pharmacy. Nurse Bonnie is there. Nurse Bonnie reviews every one of the medicines that we brought with us.
Well, I'm from Los Angeles. I work in an emergency room there at a hospital called Kaiser Permanente, which is not affiliated with the team here. And I'm here because a friend of mine, the director, that started this program called me and asked me to join them on the mission. It was actually for me a last minute call because that one person had gotten sick, and couldn't go. So I filled in for somebody. I'm a registered nurse, and I know medicines. And it's a small staff here that came, and the other two providers that are here are seeing patients, examining patients, and diagnosing what they have, and writing the orders for all their medications and treatments. So I'm the nurse that's taking out those orders and giving the medications along with all of the students. It's an honor to be here. It's a beautiful country and wonderful people, and there's a lot of work to do here. I can see that. So, a lot of illness, and a lot of people need to be taken care of, and it's really a privilege for me to be part of this team, to be here and to be participating in what's happening here.
The fifth station, individuals get a health and hygiene pack in an attractive bag, and then also have an opportunity to engage in prayer, either for themselves or some of our pre-medical students will pray together with them or for them.
One of the major components of the trip is the spiritual interfaith component. So when all is said and done, they've taken their medication, they've seen the doctor, the last thing that they do is they come here. There's some chairs set up, some kind of decor, and they sit and have a prayer, spiritual conversation with one of the volunteers. A lot of times we're praying for the patient, but even more often the patient's even praying for us. So it really is a time to kind of take a break and think about why we're here, and how fortunate we are to have this opportunity.
Also, along with the station, we give each patient a hygiene pack, and so in the bags, it's just a Ziploc bag, and it has some soap, shampoo and conditioner, a toothbrush, comb, and washcloth, just to take home with them, and then they can also use the bag for anything that they'd like.
Well, it's easy to tell the story of what we've done in the hundreds of people who we've seen, the medications that we passed out, the diagnoses that we've helped them with. Really, that's only half the story. What was significant for us is that 13 pre-med students from the United States of America come here to Jamaica to learn what it means to do real medicine, to learn what it means to see a global community, and they have had more hands-on experience in 1 week in Jamaica than I think they can get in any semester in almost any school in the United States of America. So it really is a sharing of those values, the value of education and the value of social service, which is exactly what the moniker is of Xavier University.
And we learned that the Jamaican people are amazing, they're loving people, and we love to be here. They're a true reflection of humanity, and we're so happy that we're here. Thank you for welcoming us here as well. Thank you.
I didn't feel that we had seen Jamaica at all when we saw the beautiful ocean and the sunshine, the white beaches, heard the music everywhere we went, and even began to eat some Jamaican food. We tasted Jamaica when we saw our first patient at 8 o'clock in the morning, because you can never appreciate what a country is until you know who the people are. And we have just fallen in love with the hundreds of people that have come to us for us to be of help to them, and I think they have refreshed each and every one of us.